Well, good evening and welcome to the over 500 attendees who've taken time to learn more about COVID-19 immunization for expectant mums. I know there's been a lot of discussion and news coverage and debate about immunization and fertility, benefits to unborn babies, concerns about risk, implications for breastfeeding moms, and related topics. And that's why we're offering tonight's session with two Calgary-based and internationally engaged obstetricians, gynecologists who specialize in infectious diseases and infections during pregnancy. My name is Belinda Fox, and I'm the Vice President of Advocacy and Engagement at Calgary Health Foundation. Our foundation is a social enterprise that advances breakthroughs in care, wellness, and research through generous donor support and 2 successful hospital lotteries each year. Before we get started, I'd like to point out there is a Q&A button at the bottom of your screen. You can submit questions anytime through that channel, and we'll get to as many of them as we can during tonight's webinar. We have received a lot of questions in advance, so thank you very much for your input, and have organized those by theme, as many of you share the same questions and concerns, and we hope to answer as many of those as we can tonight. This session will be recorded and available in the coming days on our Calgary Health Foundation YouTube channel. So if you missed some of tonight's session or you want to share it with friends and family, be sure to link to that site. And before I introduce our physicians, I'd like to welcome Alberta Health Services Sandra Baker to offer a traditional land acknowledgement.
Hello, my name is Sandra Baker, and I am an educator with the Indigenous Wellness Corps. My grandmothers were Mi'kmaq and Acadian. I am a proud Métis woman. I was asked today to deliver this land acknowledgement for you, and I'm very happy to do so. When the blood in your veins returns to the sea, and the earth in your bones returns to the ground, perhaps then you will remember that this land does not belong to you, but it is you who belong to this land. I would like to take this opportunity to acknowledge the land in which today's speakers are delivering from, and myself as well. This is the traditional territories of the people of Treaty 7 region in southern Alberta. This includes the Blackfoot Confederacy, comprising of the Siksika, the Pekainai and Kainai First Nations, the Tsuut'ina First Nations, and the Stoney Nakoda, including the Chiniki, Bearspaw, and Wellesley First Nations. The city of Calgary is also home to the Métis Nation Region 3. A land acknowledgement is a formal statement that recognizes and respects Indigenous peoples as traditional stewards of this land and the enduring relationships that exist between Indigenous peoples and their traditional territories. Thank you. Merci. Welalen.
Thank you, Sandra. So here in Calgary, we have top-notch researchers and clinicians in women's health, including the 2 remarkable doctors joining us tonight who are leading important global discussions about COVID-19, vaccination, and their impact on women. So we're pleased to be joined by 2 of Calgary's obstetrician gynecologists who are both clinicians and researchers. So tonight we have with us Dr. Eliana Castillo, and Dr. Castillo is a clinical associate professor at the Cummings School of Medicine in the Department of Obstetrics and Gynecology, and also an emerging leader on vaccination and pregnancy. And she partners with her patients to understand their journey during pregnancy, focusing on opportunities to engage in dialogue about interventions we know can protect mums and babies, such as immunization. And Dr. Barina Corrette, who was born and raised in Vancouver, but has chosen Calgary as home, lucky for us. And Dr. Corrette is the maternal fetal medicine head at the Cummings School of Medicine in the Department of Obstetrics and Gynecology. Her areas of interest are maternal and fetal effects of infections in pregnancy. So welcome to both of our doctors tonight. And we know, the COVID-19 pandemic continues to be stressful for many of us, and particularly for expectant parents who want the best possible health outcomes for our babies. So there's significant interest in the topic of vaccination during and after pregnancy. And we've received many questions from our audience tonight to share with both of our guest doctors. So I'm going to start with the most frequently asked topics and ask Dr. Castillo or Dr. Currit, whoever would like to jump in and answer, go for it. And if you'd like to alternate, whatever works for you. So let's first of all talk about pregnant women. So are pregnant women more at risk for severe COVID illness than non-pregnant women?
Yes, is the answer. So it's important to note that both our data in Canada and the information we have from the US and from Europe that have looked over the last year at the outcomes for women who are pregnant who are infected with COVID, we've seen higher rates of hospitalization, higher rates of admission to the ICU, higher needs in terms of oxygen support, things like mechanical ventilation. And the other really notable piece that has also been seen around the world is a higher rate of preterm birth. So while it's still rare for someone to get a COVID infection, when we compare pregnant women to non-pregnant women, there's a really clear difference in terms of the outcomes, with pregnant women being at a much higher risk if they have severe infection of having complications.
Great. And what about building on that? Pregnant women with a COVID infection, are they more at risk for blood clots, miscarriage, birth defects? Do we know anything about those consequences?
Dr. Castillo,
That's
I'll
a
let you
very
take the
important.
blood clot one. Yeah.
And thank you to the audience. So, in general, COVID-19 infection, when it requires hospital admission, it does increase the risk of blood clots. So, if someone gets COVID-19 infection and they require hospital care, the chances of blood clots are higher, and the numbers reported are 3 to 4 times higher. So for a pregnant individual or for a pregnant mom, the chances of blood clot are already higher. Any mother has a higher risk of blood clots. Mother Nature tries to protect us during pregnancy, so our blood becomes thicker during pregnancy to get us ready to give birth. That natural process makes us more at risk of blood clots. If we add COVID-19 infection to that higher risk of blood clots natural pregnancy has, then the risk is even higher. If I recall correctly, Belinda, you also asked about risk of miscarriages and pregnancy loss. As far as we know, COVID-19 infection in pregnancy may increase the risk of miscarriage, but that data is always very hard to ascertain. In terms of pregnancy losses late in pregnancy, fetal demises, as they are called in medical jargon, there is a signal. And by a signal, I mean the numbers seem to be higher, but the absolute numbers across different groups in the world are still small, indicating that it is possible that COVID-19 increases the risk of a fetal demise.
Okay, thank you. So we understand the risks associated with contracting COVID are considerable for pregnant women. So now let's talk about the COVID-19 vaccines and the question that is on many expectant mothers' minds. And we have received this question from many, many women over the last few days. How do we know COVID-19 vaccines are safe for unborn babies? So assuming that the antibodies pass from mom through the placenta to baby, how do we know that is safe for the unborn baby, given these vaccines have not been tested on children under the age of 12?
Can I take it?
Yes, go for it.
Absolutely.
Okay. That's that is a hard and a very important question. So, and I will break it down. So, number one, as Belinda has said, when a mother gets a vaccination, the vaccination, and then she makes protection antibodies, those protection antibodies go to baby and protect baby from that infection. So when a mother or a pregnant individual receives a vaccination during pregnancy, the protection that she gets is passed on to baby. So when babies are born, they are, what I tell my patients, they are loaded. Those babies are loaded with all the protection that mom has got herself in pregnancy. So babies get the protection from the mothers if the mother gets the COVID-19 vaccine. However, babies don't get the actual vaccine. So the actual vaccine product. So if a mother is vaccinated during pregnancy, the vaccine, like that foreign body that gets injected on her arm, is basically out of her system in a few days. And actually, it never goes on her bloodstream. So when you get a COVID-19 infection, the vaccination itself, it doesn't go into your bloodstream. So it doesn't get to baby. It stays on the lymph nodes kind of around the axilla where you got your vaccine. So the vaccination per se doesn't get to baby. The good thing from the vaccine, like the protection that the vaccine, that gets to baby, because those antibodies that a mother naturally makes are passed to baby through the placenta. So the answer, babies are protected, and we are not concerned that babies are getting the actual vaccine.
Right. So babies are receiving the antibodies as opposed to the vaccine ingredients. So have there been, we often look to history to predict the future. What other vaccines have been safely administered to pregnant women in the past where we've had a longer period of time to study both the benefits and risks to mom and babies?
So historically, we have been administering the flu vaccine and the pertussis vaccine, sometimes called Tdap, or pertussis is the whooping cough. Both of those are recommended in pregnancy, and we have been using those vaccinations in pregnancy for several years. And we feel that those are safe. And I think there's an important distinction to make as well. There are live vaccines and non-live vaccines. The flu vaccine, the pertussis vaccine, the COVID mRNA vaccines, they are not live vaccines. So you're not actually putting any live virus into your system. And that's why this class of vaccinations are considered safe in pregnancy, because we mount that immune response, we make antibodies. Those antibodies are the only thing that crosses the placenta and provides passive immunity to the fetus.
And if I may add, there is one vaccine that we almost never mention, but it's probably one vaccine that for which we have like 40 years of experience in pregnancy, and is the tetanus shot. 40 years ago, there were babies in many places in Africa, in Asia, that would die within 1 week of birth from tetanus. And what was happening is that at the time of birth, the umbilical cord was cut with whatever was available for some of these women and babies. And sometimes it was not in a very sanitary or a sanitized instrument. So that instrument would actually give the tetanus germ to the baby, and then baby would die within 1 or 2 weeks. So I'm going to say 35 years ago, at the time, the equivalent of the World Health Organization figured out that we had a very good vaccine for tetanus, and it's more or less the same vaccine that we use nowadays. And the strategy was to make sure that everyone, and that every woman who could potentially get pregnant, and that included young girls, would get the tetanus shot. So a lot of money went to make sure that everyone who could potentially get pregnant would get the tetanus shot every 10 years. And with that, neonatal tetanus has been eradicated basically everywhere in the world except from 2 countries. So we almost don't think of that vaccine, but that strategy of vaccinating the mom to protect the baby, we've used it for decades now.
Wow, I hadn't thought about tetanus. That makes a lot of sense. So I think, Dr. Courage, you answered the next question. It sounds like the question is there a preferred vaccine for pregnant women? And it sounds like it's the mRNA vaccines is what you would recommend. Is that correct?
That's right. The provincial guidelines and the NACI, which are the National Advisory Committee on Immunizations, they both state that the mRNA vaccines are preferable. And this is largely because we have more data about those vaccines. In particular, we look to our colleagues and the population in the US. They have vaccinated, I think, over 200 million individuals in the US. And with that comes a pregnancy registry. And I looked at it just yesterday to get the most accurate number, and they have over 100,000 women who have registered, who essentially received a vaccination from either Pfizer or Moderna, so an mRNA vaccine, and have registered on this website. They are pregnant, and they've analyzed about 35,000 of those participants to look at the outcomes. So looking at things like miscarriage, stillbirth, preterm birth, fetal anomalies, which is a big concern for many people related to the vaccine. And there are no signs whatsoever that there is an increased risk of any of those issues in that cohort of 35,000 women who have been vaccinated. So I think that really helps us feel more confident that we do have data that supports the use of mRNA vaccines in pregnancy, and that we are not seeing any increased risk of adverse outcomes for mom and babies once vaccinated.
Okay, great. So just one more question related to the mRNA vaccines, which are available to us in Alberta as Pfizer BioNTech or Moderna. Can you tell us a bit about how they work? There are some people concerned that these mRNA vaccines somehow alter our DNA, and then there's, concern that they may alter the DNA of unborn babies. Can you explain that to us, that technology?
Sure, I will take it. So it's the mRNA platform is not a new platform. The mRNA platform had been tried for about 25 years ago, and it was used to make vaccines actually against cancer. So the reason we got the mRNA vaccines so fast was because the platform was ready to go. How does an mRNA vaccine work? Traditional vaccines contain tiny bits and pieces of the actual virus or the actual bacteria of the germ. And sometimes it's the whole virus or the whole bacteria, or sometimes it's just a little part in the outside of that virus or that bacteria. The mRNA vaccines don't contain any of the actual virus. They contain the instructions to make something very similar to the spike protein. I think all of us have seen, those fancy pictures of the COVID-19 virus with the dots that look like a corona, the crown. So what the mRNA vaccines is, they contain a set of instructions that tell our system how to make that spike protein. The nice thing about the mRNA vaccines is that those instructions go into the cell, but they don't go into the nucleus where we have our genes. So, all cells, brain cells, muscle cells, where we get the vaccine, lymph node cells, all cells have a nucleus, like the core. And right in the core is where the genes that code for our skin color or our eyes, the genes are in that core. So the mRNA vaccines do not get into the core because the instructions can be read outside of the nucleus, outside of the core. So those instructions never get mixed up with our own genes, like our own instructions. The instructions that the vaccine carry to make the spike protein stay on the factory that makes proteins. So our cells, when we get vaccinated, our cells get the instruction about how to make something that looks very similar to the spike protein of the COVID-19 virus. And then that spike protein goes out to the cell and says hello to our immune system. And then our immune system makes antibodies against the spike protein. And that's how we get protected. But it's a beautiful technology. We get the instruction, we learn how to make something that will protect us against the virus. The beautiful thing is that vaccine never mixes up with our own genes.
I'm sure very reassuring to many of us. So very easy to understand explanation. Thank you for that, Dr. Castillo. So we know vaccines provide benefits to moms, to babies. We know the mRNA vaccines are the preferred option. Now, what about timing? Is there a better time during the gestation of babies for moms to pursue the vaccine?
So I would say that there's lots of parts to that question. The short answer is no, there's no better time than any other time, that any vaccine is better than no vaccination, better than getting COVID and getting really sick. But when you start to drill down a little bit, I think the conversation that I'm having with a lot of my patients is more around what's your individual risk? And that helps guide us in terms of when we might want to vaccinate or receive a vaccine in pregnancy. Particularly, some people are hesitant in the first trimester. So in the first trimester, it's when the fetus is forming, when there's organs forming. It is one of the most sensitive times for the risk of fetal anomalies because those organs are developing. So some people say, well, maybe I should skip it in the first trimester, wait until the second or third trimester. If you are in a low risk environment, let's say you work from home, your spouse is working from home, um, you don't really interact a lot with the public, you get your groceries through click and collect or delivered, and really you have a very small risk, then yes, I would say if you feel better about waiting until the second or third trimester, then that's a good option for that individual. However, the flip side of that is a healthcare worker, someone that works in long-term care facility, someone that works, interacting with the general public, works at McDonald's, Shoppers Drug Mart, a grocery store where you might not have access to PPE all the time, and you're dealing with a lot of people every day. People that are in those settings, or let's say they have they live in a house that has multiple family members, so they live in a more crowded home situation, or with elderly parents or another family. Any of those settings might put you more at risk because your exposure is higher. So in that case, getting the vaccine at any point in pregnancy might be preferable. The bottom line is that there is no indication that there is a risk of receiving the vaccination in any trimester in pregnancy. But I will add to that it is fair to say we don't have as much information about vaccination in the first trimester, because in things like the big registry in the US, the women who have been vaccinated in the last few months who are in their first trimester, they haven't delivered yet. So we don't have their outcome data.
That risk benefit discussion sometimes also needs to include the partner. We have species, there is a team of us, including Dr. Kuret, of course, who has looked at all the positive COVID-19 in pregnancy cases we have had throughout these 15, almost 16 months of the pandemic. And we have seen cases where even if the pregnant patient or the pregnant woman can afford to stay at home, which is not the option for many of them, but even if that is the case, that she can stay at home or work from home, sometimes, and actually in a substantial proportion of our positive cases, we have seen that it is her partner who sometimes may not be able to work from home. So when a mother or an expectant family is trying to make that decision, as Dr. Kuret was saying, is not only what she does or where she stays, it's also what the people around her does and stays. And that includes for sure the partner. And we have many partners who are essential workers, frontline workers who have to go out and make a living.
Oh yeah, the household exposure is huge in our pregnancy population. Absolutely.
Yeah, that's an excellent point, because we've all been reading about families with COVID admitted to hospital. So very important reminder. So then what about pregnant women who have had COVID, are still pregnant? Do we know how long their immunity lasts? In other words, when should they consider the COVID vaccine after having the actual illness?
Go for it, Dr. Castillo.
Belinda, that is a very important question, a difficult question based on the small amount of data overall we have. Our provincial registry, and she's not with us today, but Melanie Pastuk, the nurse coordinator for our project, who takes care of all of us and all of the 2,000 pregnant moms out there who had COVID during the pandemic in Alberta. Looking at our data, we have found several cases where pregnant women in Alberta have had an infection, a proven COVID-19 infection, let's say in the first trimester of their pregnancy. And now in the third wave, they have acquired COVID-19 infection again. So that is a very, very important message for those mothers who have had COVID-19 infection during their pregnancy. I don't know, and there is a lot of data out there that varies a lot about for how long are you protected if you got the real infection. But what we do know is that that infection does not last years and may last only months. And in the handful of real pregnancy Alberta cases that we have seen of repeated infection, the interval has been 6 to 7 months. So we have had several cases of mothers who had COVID-19 infection in the fall and now in the third wave have had another infection. Some of that may be related to the fact that their second infection in the third wave may have been related to the so-called UK variant, the B117 variant. But it may be that is not related to the variant itself. It's just related to how we make antibodies during pregnancy. And on that point, when patients and colleagues have asked us, my patient had COVID-19 infection in October, is it worth for her to get the vaccine? My answer to them was always yes. There is benefit for her to get the vaccine, even if she got the infection. And our answer was that based on 2 or 3 research papers from the US that showed that the protection antibodies that a pregnant mom would pass on to baby were stronger and stickier and in higher quantities if those antibodies came from vaccination compared to antibodies that came from having had the real COVID infection. Based on what we have found literally this weekend, looking at our experience in Alberta, certainly confirms that.
Oh, I just wanted to quickly add, Belinda, that same study looked also at the amount of antibody we make after the first dose and then again after the second dose. And not only does vaccination significantly increase the amount of antibodies you make when compared to having a natural infection, but getting that second dose or the booster that some people are calling it makes a huge difference as well in terms of increasing your antibodies. So completing the whole course, whether that's during the pregnancy or one in pregnancy, one postpartum when you're breastfeeding, which we can't forget our breastfeeding moms. We also feel that it's a safe choice if you're breastfeeding. We encourage you to also complete both doses.
Excellent. You just answered our next 2 questions because they were exactly that. Difference in antibodies for baby between 1 and 2 doses, and then the strength of the antibodies from mom had the COVID infection versus mom had the vaccine. And then on the topic of breastfeeding, so are the COVID antibodies from either a mom who's had COVID or a mom who's been immunized, are those antibodies passed through the breast milk to the baby?
Yes. They are.
And
Great.
again, they are they are but again, to reemphasize that the antibodies that a baby gets if mother received the vaccine are in higher quantities and are what we, again, the medical jargon term, neutralizing antibodies, the ones that can really put a stop to an infection. Because when we get an infection, we can make antibodies against many different parts of virus. But not all of those antibodies will be those that we call the neutralizing ones, the ones that can really make that virus stop on its tracks. Those studies that Dr. Kuret and myself have alluded to have shown that the antibodies that come from the vaccine are more the neutralizing type, the very effective ones in breast milk and in cord blood.
Right. That's really reassuring to know. And so one of our mums is asking, if she pumps breast milk and freezes it, is that going to damage the antibodies? Is there any interference from the freezing process?
So I think that is a very hard question to answer because that hasn't been tested per se. In general, we see that antibodies that are frozen for or longer time can lose some of its potency, especially if they are frozen in household fridges rather than laboratory range fridges or freezers where the temperature is tightly controlled. So, but how long would it be for the antibodies to disappear? We don't know. I think those antibodies, it's very reasonable to assume that those antibodies would be on the frozen milk for weeks. But we don't know exactly. But that's a very good question. Thank you.
Just going to add that pumping in general, if you're pumping breast milk but not freezing it, absolutely there's antibodies. The mode by which we feed the infant, whether it's directly breastfeeding or whether it's express breast milk that's bottle fed, both of those would provide good passage of the antibodies through the breast milk. But as Dr. Castillo explained, we're just not really sure about the freezing. There are very few studies that include any information on breastfeeding and women who are lactating in terms of all medications and clinical trials. So it highlights an area that we really desperately need some more research and information to help guide us.
Yeah, very important. Great points. And one last question along these lines, and then we're going to switch to the topic of fertility, because there's been some interesting media coverage. So we have a few women on our webinar tonight who wonder about any recommendations you might have for those who have high-risk pregnancies, maybe older moms, maybe those who've had IVF. Are there any circumstances where you would discourage an expectant mom from getting the vaccine?
Rennie?
You know, I think that high-risk pregnancies in particular are ones where we want to try to keep our moms as healthy as possible. And so the COVID vaccination is all the more important. We have not, if you look at adult data separate from pregnancy, if you look at transplant recipients, if you look at patients who are currently receiving cancer treatments or who are immune compromised, COVID vaccination is recommended in all of those situations. And so I think you can extend that understanding and recommendation to pregnancy as well, that a mother there is good data that tells us that the women who actually are more at risk if they are infected with COVID are those that have what we call comorbidities or have other issues along with their pregnancy. Things like hypertension, diabetes, chronic lung disease, obesity, all of those add to the risk. And if they get really sick with COVID, makes it that much harder for them to recover and to be treated. So I would encourage women who are considered high risk to have a conversation with their care provider and to strongly consider the vaccine, because and Dr. Castillo, you chime in as well, but off the top of my head, I can't think of a group of people who I would say don't get the vaccine. I manage high risk pregnancies. That's all I do in my clinic, and we are really encouraging women to consider it because we do feel that it is the safest option going forward.
Thank you, Dr. Corret. And Belinda, there is not one medical condition. I take care of pregnant patients who have medical complications and infections. So there is not one medical condition for which the mRNA vaccines, and that's both Pfizer and Moderna, despite what goes on in social media, for which there is an absolute contraindication to get the vaccines. And even for those patients who have had a reaction to the first dose, the majority of patients who get a reaction to the first dose, there is more and more data coming up that it is safe for them to get the second dose. It's only a very tiny minority, and tiny minority, we say like 1 out of 10 or 12 million people that has like a real wild allergic reaction to the mRNA vaccines. For those people, the Alberta and as well the National Advisory Committee for Immunization have recommended that we should consider another product. But for most people, basically for everyone, even for those who have had a reaction to the first dose of an mRNA vaccine, the recommendation is still to go ahead with the second dose.
Okay, great. That will put a number of women's minds at ease. So thank you for that. So the last topic, and we've had a lot of questions along these lines, relates to fertility and conception. So do any of these COVID-19 vaccines interfere with a woman's menstrual cycle, with fertility? Should couples considering starting a family time their conception with vaccine timing? Anything to consider in this realm?
So there's lots of things to unpack in what you were just saying, Belinda. So the first thing that I want to say is there is no data that tells us that your fertility is negatively impacted by getting the COVID-19 vaccine. And I think, there's a lot of information on social media. There were a lot of comments made. And in some way, it's understandable. When something is new and we don't know a lot about it, it's wise to be a little, not skeptical, but to get yourself well informed. So I, in preparation for this, I did a bit of a deep dive to see if I could figure out where is this fertility issue coming from and what do we know about it. And there's some really good information that is reliable from the CDC, from the American Fertility Association, from the North American Association for Pediatrics, for Gynecology and Pediatrics. And all of them tell us that it does not cause fertility issues. There has been no increase in miscarriage. There is also no change in people's ability to conceive. What we are seeing when you look at menstrual periods, there's lots of chatter out there about how it can affect your menstrual period. And there may be something to that. but it's not necessarily a negative impact. When you look at the data, again, similar to our lack of information about breastfeeding, because breastfeeding women aren't included in studies, nobody ever asks about changes in menstruation when they're looking at side effects or the effects of a vaccine. When you look at those questionnaires, and not just COVID, but for any vaccine, we don't ask about that, which is a huge missed opportunity. So I would say we are all at a heightened awareness. We are all on social media trying to share as much information as possible. So it could be that if somebody is having a heavier menstrual period, or if they have a skipped menstrual period, that could be related to getting a vaccination. Some of the thoughts around that are maybe you're stressed. You're feeling a little bit nervous about the vaccine. And we know that stress can certainly alter your menstrual cycle. Maybe it's just that we have a heightened awareness and that we're paying attention to our period around the time we get the vaccine. Or maybe the vaccine does trigger an immune response. The endometrium, which is the lining of the uterus, is part of your immune system. And so maybe the spotting or the heavier bleeding is related to your body mounting a reaction to the vaccine, which is what we want it to do, and in turn stimulates your endometrial lining and the lining of your uterus. And that's what you shed every month. And so therefore, maybe you're having some changes in your period. So I think we need more information. When I was doing some looking around, I found that there is actually a study that's been started in the US looking at menstrual experience with the COVID-19 vaccine. So some smart scientist out there has decided that, if we don't know the answer to something, let's try and figure it out by collecting as much information as possible.
And if I may add, thank you, Dr. Corret, there is actually a group in Turkey. They one of the studies where they are testing one of the Chinese vaccines, Novavax and COVID. They are specifically asking people who have got vaccinated about their periods. So I think between the data that we're going to get from the study in the US asking specifically about menstrual periods, and the data using the data from Turkey, we will get an answer. And in preparation for another similar event I had last week, I also looked at some data about fertility specifically. And as probably all of you are aware, the Israelis were very ahead of the curve in terms of vaccinating their population. And there are at least 3 or 4 studies that are coming out of the of Israel, and all those trying to address the question of fertility, which is very difficult to address, and periods. So these doctors who actually work in fertility clinics, they went back, and a lot of the time they had stored eggs and stored sperm from couples who are seeking fertility treatments. And sometimes, couples give samples, and they had the opportunity to study couples who were patients of the fertility clinics before being vaccinated. And then they had the opportunity to get samples from the eggs or the sperm after they were vaccinated. So they were able to compare sperm counts and how the eggs for some of these women behaved in the presence of the COVID-19 antibodies. Based on those small but well done Israeli data, comparing fertility fertility function before and after the vaccine, there is no indication that fertility is affected by the vaccination. On the other hand, there is data from the US looking at males who got sick and admitted to the hospital for COVID-19 infection that has documented a decrease in their sex hormones and decrease in the sperm count. So, there is some data coming up on long couple who has had the symptoms of weakness, etc., after the COVID infection for months and months, and looking at male sexual function being affected, or again, a small proportion of those who have suffered from COVID.
I think it's also really good to think of it in the broader context that if you look at all vaccines, there's not actually any evidence that any vaccine causes problems with fertility. So we also have to say we don't really have a track record of worrying about that. And yes, there's lots of emerging data coming out and we need more information. But so far, I think there are lots of adverse event and tracking systems in place, and none of those are telling us that there's a change in people's fertility.
And maybe just a last remark on fertility. It's not the first time that as humans or as communities that we have worried about vaccinations messing up with very intimate and important things for us as a society, as couples, as families, like fertility or periods. So there are at least 2 or 3 examples in the history where communities that have been under the political strain or warfare, where vaccinations have been used to create fear, and that fear has fueled even more fear among us. So polio, which is a terrible disease, and has left millions of children, now adults, incapacitated or limping for life. Polio has a very effective vaccine. And there was a rumor in Nigeria about 15 years ago that the polio vaccination campaign was some sort of political scheme to cause infertility among a specific sector of the population, and that we should stop the polio vaccination campaign. And it was actually stopped by the governor. And that rumor, and this is before social media was so prevalent, that rumor propagated, and then the effort to eradicate polio from Africa took a step back for about 10 years. And even though it's very different to what we are living now, because the COVID-19 pandemic has affected everyone, rich, poor, cold, warm climates, it doesn't matter. It has affected us all. I think in situations like this, when there is so much uncertainty and we don't know when we're going to get our life back, we are more sensitive and we are more fearful. And then we may pay more attention to the things that Dr. Couret was saying, and we may worry about, and we just worry more about things so close to us like fertility or periods.
Right. Really important points. And just before we close off on the topic of research, because I want to ask you about the research you're doing in Alberta for Alberta women related to COVID. We have quite a few people who are asking, is there a preference or a difference between the mRNA vaccines under the brand names Moderna and Pfizer? Are they different? Is one preferable over the other?
Very important question, Belinda, and I will take it. So apart from the brand and one substitution, they are basically the same. And importantly, the protection that both Pfizer and Moderna provide, and the protection they provide specifically for hospitalization, severe infection, and admission to the ICU is exactly the same. Exactly the same, both for Pfizer and Moderna. There's really no difference whatsoever on how potent and effective in real life also they are to keep us at home, outside of the hospital, and outside of the intensive care unit.
Can I quickly go back to, I think in the previous question, you'd also ask about timing of the vaccine for people considering pregnancy. And I think what's important to mention there is, if possible, it would be preferable if people completed their both doses of vaccination prior to pregnancy, but recognizing that we have a bit of an extended period now between the first and the second dose. Certainly you can get your first dose when you're thinking about conception, and then the second dose can happen during the pregnancy. And if at all possible, we are really pushing to have not only pregnant women prioritized for the vaccine, but also prioritized for their second dose, so that they can get that second dose and get all the benefits of that during pregnancy. Also recognizing that when you're in the first few months of being postpartum with a brand new baby, it's hard to organize yourself. It's hard to even get a shower at the end of the day, speaking from experience, having 2 children myself. But the logistics of getting yourself out to a vaccination clinic is also of concern. So we want to say, get out there, get your vaccine, and try to get both doses in if you can during pregnancy.
Yeah, sage advice. That makes sense. Thank you, Dr. Currit. So to close off in our remaining 3 minutes we have with both of you this evening, could you tell us about the research you've been doing on both COVID, the vaccines, and pregnant women in our province, and what work lies ahead, and what do you expect to learn from all of this?
Thank you, Belinda. So there is a national effort to really understand what COVID-19 and what the COVID-19 pandemic means for pregnant women, pregnant patients, and their babies and their families. So there is a national registry where, in collaboration with like the public health officials and the laboratories, we are trying to identify every single case of COVID-19 infection in pregnancy. I have to say, in Alberta, the collaboration with public health authorities and the lab and the nursing team that works for Dr. Currit, those high-risk obstetrical nurses, have all come together, and we really just came together more than a year ago without any funding, and said, we just have to get this done. We just have to make sure that we account for every single case, and we make sure that that mother is and her and her family are okay. So that study is called Can COVID Preg, and we have and COVID has not ceased to surprise us. The numbers that Dr. Currit was talking about what it means to have COVID, the chances of going to the hospital, being admitted to the intensive care unit, all of those real numbers have that we have seen in Alberta and in Canada have helped actually our government. And I have to say, Alberta and Ontario were the first 2 provinces in the whole country to prioritize pregnant women for the COVID-19 vaccine. Dr. Hinshaw, Dr. Hugh, thank you for that. They listened to the data we presented for them about the risk that COVID-19 infection poses to mothers and babies. And in terms of next steps, there are two aspects of that we are learning more and more. One is actually what it means for the placenta to get the COVID-19 infection, and what happens to the placenta, and how can the placenta keep supporting the pregnancy, even for those women who have had sometimes maybe just a mild infection in the first part of the pregnancy. And maybe Dr. Kure can elaborate a little bit more on that. And the other aspect that we are looking at is that we are striving to be very accountable and be very transparent about something that is called pharmacovigilance, meaning that if we are telling Albertan moms and families to get vaccinated against COVID-19, that we are checking to make sure that the vaccines are doing exactly what they are supposed to do, and that we have a good vigilance in place for those very rare and adverse side effects that sometimes we don't see unless we do millions of doses. So we are in the process of setting up a system that will allow us to actively be checking and be in the position to reassure Albertan moms and babies with with Albertan data about what vaccines can do for moms and babies, and very importantly, make sure that we are very prepared next time.
Yeah, exactly. It's, you used the right words.
So just to add to that wonderful explanation is to say that in a year that's been really tough, there have been a few silver linings with COVID. And one of those, I think, has been that both provincially and nationally, we have come together, we have collaborated, and we're sharing information. So with our team here in Alberta, we're tracking all of the infections in pregnancy. We are using the information and the outcomes that we're seeing for moms and for babies, things like hospitalization, preterm birth rates, etc. We're using those to inform our clinical practice, to put guidelines out, to reach out to some of the remote parts of the province who might not have access to all of the things that we do in places like Calgary, and provide them with the support, the information, the resources that they need. So that's a big part of the work that we're doing in Alberta. And by partnering with all of the provinces and territories across the country, it gives us bigger numbers of data to look at to say, well, yes, these outcomes are real. And hopefully we'll be publishing some of that data soon. And now taking the next step to look at vaccine trackers, vaccine registries, all of which are coming out now specifically for the pregnant population. And we are so lucky in Alberta to have all of the support, both in terms of funding and the support from public health and from our AHS leadership to help us get there.
Terrific. And we're fortunate to have researchers and clinical specialists of your caliber to take this on. Women are in extraordinary hands, and that's super reassuring. So we have a number of participants on the webinar tonight who are asking, can they get involved in the research? Is there, if someone's interested in participating, who should they talk to? Where should they go?
Well, thank you very much for that. We are working.
That's exciting.
We are working.
It's awesome.
Yes, that will allow us to bring you on board. I probably going to say that the best way to get a hold of us is the phone number for our clinic right now. We are in the process of setting up a website and a proper email address so we can bring you on board. And bring you on board, for example, because if you have been vaccinated, part of the national collaboration we have going on is to do follow-up on you having been vaccinated in pregnancy and what your experiences have been. So, Dr. Correa, I'm just going to share the phone number that we have in our Repro ID form. We don't have an email, but it's coming soon.
Well, and I was also going to say that there is now a part of the national collaboration that we have. There is something coming out. It's called Covered. And it is a registry, not just for people who have received the vaccine, for people contemplating getting a COVID vaccine in pregnancy, for people who don't plan to get a COVID vaccination in pregnancy. If you look up Covered and UBC, they will be having a link where you can register your interest in being contacted to understand what your experience is and what your choices and attitudes are around COVID vaccination. So it's a great way to participate. And that's more on a national level. And then, as Dr. Castillo said, in the coming weeks, we will be we're in the process of creating a platform that women can go to more locally based in Alberta, where you can get data, you can register your interest in being involved. We're even trying to organize things like a patient council to tell us, what's your experience? What are the things that are driving you? Or what are the gaps in information that we may not think of as practitioners? So I think there's lots of opportunity, and we welcome your input.
Thank you.
Fantastic. And we will pass anything you have to share with our participants about getting involved. We'll be happy to pass that on. Absolutely.
Perfect. Thank you.
So I think we went through, I'm just looking at the questions here. I think we went through the majority. We will send a follow-up email and answer questions we didn't get to tonight. And like I said earlier, we'll have a recording of tonight's session on our YouTube channel as well. So stay tuned for that. And if you're not able to participate in research, but you would like to support the work that is happening through the Calgary Health Foundation in the area of research, we always welcome donations from our community to advance care, wellness, and research. So thank you so much to our extraordinary doctors, Castillo and Currit. Keep doing what you're doing. Thank you so much for choosing to care for mums and babies in our community. We sincerely appreciate everything you do.
Thank you.
Thank
it's
you very much.
our pleasure. Hopefully we can keep helping.
Terrific. And thanks to all those who took an hour out of your Tuesday evening to join us for this important topic. So take care, everyone.